Hi, everybody. Thank you so much for being here. I apologize for the inconvenience. We had the webinar set to the incorrect time. So our calendar and marketing materials said 6:30, which is our normal start time. And the Zoom webinar was set 30 minutes ahead. So I apologize, but thank you so much for joining us tonight. My name is Sophia DeGiorgio, and I work in marketing, communications, outreach and engagement at University of Iowa Healthcare. Thank you for joining us this evening for our Meet the Midwives webinar. You'll hear from our experts on our nurse midwife team shortly. Before we begin the program, I have a few logistics to share to make for a great virtual experience. This program is hosted in a webinar format, meaning you will only be able to see our UI Healthcare speakers on your screen. In the upper right-hand corner of your screen, you have a few options to change your view of the speaker and presentation. At the bottom of your screen, you can click the Q&A button to submit a question for our speakers at any time during the program. When entering your question, you can choose to submit your question anonymously. We will also be addressing questions that were pre-submitted upon your registration throughout the program. Closed captioning is enabled, and you can choose to turn that on by using the closed captions or CC button at the bottom of your screen. You can adjust the size and placement of the closed captions on your screen with this button as well. Without further ado, we will begin tonight's program. I will now turn it over to our nurse midwife team.
Thank you, Sophia. And once again, big apologies for the mix up. The midwives are all used to 6:30, and so that's when we all came on. So very sorry about that. I do think it's going to be recorded tonight, and then also we'll send out for all the registrants, we'll send out something at the end with things that we talked about tonight and links if you guys need them. So my name is Amber Goodrich. I'm one of the certified nurse midwives. I'm the division director for the midwives. So we have these quarterly events so that we can have the opportunity for you all to see our face via Zoom. And because we know that while you don't get to meet all of us in clinic, we share labor and delivery call. And we just want you guys to all to feel comfortable. This is a space that we will talk to you a little bit about what midwives are and kind of give you some pregnancy prenatal tips and tricks, and also let you know about all the services that we offer. There is a Q&A in the bottom of your Zoom. Please feel free to put questions in there, and we'll also address the pre-submitted questions. So a little bit before I'm going to have all the midwives introduce themselves. Some of them are on labor and delivery, and so can't be with us tonight, which is kind of the nature of our job. But I wanted to let you all know that we have many different locations around the area. You can see us at main campus, Iowa River Landing, North Dodge Clinic. And I should also mention at Iowa River Landing, we have evening clinic appointment times. So both of the Lauras, Laura Dellis and Laura Hannah-Bergen, see patients there. I believe their last appointment is at 7:15, 7:30 p.m. So that's really nice and convenient. And then another thing that's really important to us as midwives is to expand rural access for folks who perhaps live far away and their OB unit may be closed, or they otherwise don't have OB-GYN care. So we have clinics in Muscatine, Iowa, and that is where we are 4 days a week. And we have ultrasound there, lab there. Our midwives are there. We also have an OB-GYN there. And we also are in Washington, Iowa, once a week on Fridays. And same thing, we have ultrasound and lab there available. And then Cedar Rapids, Iowa, because there's no midwives in Cedar Rapids. And so we're there once a week, again, have ultrasound services, lab there as well. We do births at the main campus. So the big house is what I call it on Hawkins Drive. And also we are doing births now at what we call our downtown campus, or formerly known as Mercy. We're really excited to be there. It's more of a community hospital setting that we're shifting some of our low risk birth there. And so what a perfect place to put midwives. So you can catch us at any of those locations. So without further ado, I'm going to go ahead and go through the list of midwives, and then I've assigned all the midwives a question to answer, and I put myself in there. So first I'm going to just tell you what exactly is a certified nurse midwife and how is their training different from other birth providers. And certified nurse midwives at the University of Iowa, we're all nurse practitioners. So we were all nurses by trade. So we were first RNs, went back to school to get all of us are at least master's prepared, some of us doctorate. And we provide full scope obstetric and gynecology care, ranging from prenatal care, preconception, annual exams, birth, um, gyne problems, and all that good stuff. And that's a little bit different from obstetricians, where obstetricians do surgery and they usually their expertise is taking care of higher risk pregnancies. Midwives don't do surgery. And we really try to focus our care on normal. Um, you may have heard of other midwives called certified professional midwives. Those are community midwives that they generally do home birth. So that's kind of the big differences there. Abby, I know, is on labor and delivery. Okay. So Abby Knutson is next. I guess I didn't go in alphabetical order because I said myself first, but Abby is on labor and delivery. And she typically has clinic at North Dodge. Next, we have Andrina. And Andrina, if you could just tell us something you recommend packing in your hospital bag that we don't usually talk about.
Hi, I'm Andrina. Do you want us to go over like what clinic we're at and stuff like that first?
Yeah, that'd be great.
Okay. So I typically go to North Dodge on Thursdays, and then on Fridays I'm at Outreach Clinic in Washington, Iowa. And then I just work labor and delivery at both hospitals, depending on the day. What I recommend generally taking with you in the hospital is things that are going to make you comfortable. They're pretty relaxed on things that are allowed in the room, as far as whether you bring your own music, whether you bring your own essential oils. Some people will bring comfortable pajamas, clothes, nursing bras are things that I think are really helpful. Some people will bring their own pump. If you choose to pump, they also have those that are available there. And so those are the big things. Snacks are really big. The cafeteria is a little bit far away. They do have food that they do bring up, but I do think bringing things, if you do not choose to get an epidural or whatever the case may be before that, then you can have whatever kind of food or snacks that you want. So that's something that I always recommend.
Thanks, Andrina. And then Bree is also coming off of labor and delivery. Bree Herring is another one of our midwives, and you can find her in our Cedar Rapids clinic. And she does births at both campuses as well. And then Christina Shutters, I don't think is on quite yet. But she is one of our 3 midwives who does her clinic in the high risk OB clinic, which is really unique to our institution. So she still is able to see patients in the high risk OB clinic under the supervision of a maternal fetal medicine physician who is truly an expert in high risk birth. So some of our high risk patients can still benefit from midwifery care, which I think is really unique. Next up, we have Jackie Roman.
Hi, I'm Jackie. I see patients in at the North Dodge Clinic on Mondays and in the Muscatine Outreach Clinic on Tuesdays. My question is, what is your favorite part of being a midwife? And I have a hard time picking a favorite because there's so many amazing parts of the job of being a midwife. Who doesn't love getting to experience the moment of birth with families? That is fabulous. But I really think one of my favorite parts is actually being able to care for my patients, maybe as a well woman before they become pregnant, and then walking through pregnancy with them, having that delivery experience, taking care of them as they grow as a mom and as our kids grow. And it's just a really fun experience to be part of your life.
Thanks, Jackie. And next we have Kimberly Sprague. Kimberly, your question is, what services do you provide beyond care and delivery? Oh, Kimberly was on here. Is she gone now?
Oops. Hello, I'm back. Can you hear me
Oh,
okay?
hi. Yes, I
I
can
hit the
hear
wrong
you.
button. It's all about the buttons.
Yes.
So anyway, I'm Kimberly Sprague, and I am usually working on Thursdays and Fridays in the Muscatine Clinic. And we provide actually very full service there. So I do colposcopy. I think I was asked if people come in before or after they find out they're pregnant. Also, we actually do a lot of preconceptual care. I think personally, I really like working with some of our younger girls to kind of get them into good, healthy habits of establishing good um, gynecological care and reproductive care, and learning good habits and how to manage and care for themselves right from the beginning. But we also, I don't know, in Muscatine in general, we have the NSTs and ultrasound. We have all of those services. So,
Thanks, Kimberly.
yeah.
Lastasia Coleman is up next. Lastasia, your question is, how do you collaborate with OBGYNs?
Hi, everyone. Like Amber said, I'm Lastasia. I have been here with the practice since 2016. I primarily see patients at our North Dodge location on Wednesday mornings. And I am also the program director for our midwifery education program. And we're very excited. Our first class graduates tomorrow morning. So big day for all of us. As far as how we collaborate with the OBs, Amber kind of talked a little bit about how we collaborate with MFMs. The nice thing about our practice is we have pretty seamless, conversations and consults and transfers and things like that because we're all in the same department. So, if something changes during a pregnancy, we can maybe sometimes it's as simple as asking a question. Sometimes it's more serious and it needs to be a transfer of care. But we have really great access to our OBs and, sometimes even in labor and delivery, we're catching babies for them too. So it's definitely a team environment, a team practice. So that's one of the things we all enjoy about working here.
Thank you, Lastasia. And yes, big shout out to our 4 nurse midwifery education program. The first midwifery program in Iowa are all graduating tomorrow. And this was a proud mama moment for all of us, I think, as we're crowning. The babies are coming. Next, I have Laura Delos. And Laura is one of our what I call OG midwives. She's been around for a long time. We really appreciate her so much. Laura, how do you collaborate with doulas? And if you could also talk to us about the myth that midwives are the same as doulas.
Sure. I see OB patients primarily at Iowa River Landing right now. I'm there Wednesday afternoons and evenings. Doulas we consider our real partners in this process of childbirth. We love it when our clients are able to have a doula, and Amber has been instrumental in working on a grant to bring doulas for folks to be able to have here in Johnson County under a program that helps people that might not otherwise be able to afford a doula. And then we also have training those folks in that speak various languages to work with women. So I think one of my friends that's a doula put it best. She said, Laura takes care of everything sort of right here. I'm pointing to my belly and to my chest. And she said, and I take care of everything kind of back here. So I'm helping you stay calm. I'm helping give suggestions. I'm massaging your back. I'm helping with your hips. And these are all things that as your midwife, we will do as well. But a doula just plays a special role in that they're just with you that day for your birth. They'll meet with you ahead of time. And we encourage them if they want to come to a visit. And so it's really a synergistic role with your healthcare providers. They're not providing any medical care or direct medical advice, but they are there to support you through the process and be your advocate. The training is quite different. A typical training for to be certified as a doula is maybe a 72-hour program. There's self-study. And most programs require that you would then do a certain number of doula experiences with clients and get feedback from providers. And whereas our education process is either a master's or a doctoral program in nursing. So it's much more extensive on our end, but I think you'd find many doulas in this community who are incredibly committed to the women they serve.
Thank you so much, Laura. And since you mentioned the program, it's okay. I'll just have a plug out there for it. It's a really great program that we train 10 community doulas, and they're, like Laura mentioned, they speak different languages and they're from different backgrounds, because the research shows that if you have a birth provider who looks like you, the outcomes are better. And actually having a doula in general, the outcomes are better as far as vaginal birth rates, breastfeeding rates, satisfaction rates. So something really great if you can invest in it. But if you're somebody who maybe isn't able to invest in it and you live in Johnson County, talk to one of your midwives about signing up for the doula program, and you could qualify for a doula at no cost to you. Laura Hannah Bergen, your question is, how do you assist with breastfeeding, recovery, and emotional well-being after birth?
Hi, I'm Laura number 2. I work also at the Iowa River Landing, and it's primarily on Tuesdays, which go from like 1 p.m. to around 7:30 in the evening. And I really like having those evening hours available to people. How we assist. So the assistance, I think, really starts early in pregnancy. We start talking to you about what you want for your breastfeeding experience, and like just getting like your history, like how have you been coping with things up till pregnancy and through pregnancy. And that kind of helps us work together and guide you on what will be our role as far as supporting you throughout the rest of your pregnancy and shortly after your birth. We do hands-on support, of course. We also, a lot of us are like either lactation counselors or have a lot of lactation experience. So we do guide you with that as well. We do also have certified lactation consultants who are in the hospital and can be there if you need them, or if you even need them before the baby comes. Like, let's say you're worried about either something you experienced with a previous pregnancy and breastfeeding, or you're worried about things. You can often meet with them prior to your birth to just get like a full assessment and talk about any concerns you have. We also guide people on how to what we call harvest colostrum. This is something we've been doing for the last few years to help prepare people for just being more familiar with their breast. I think even if you aren't able to collect a bunch of colostrum in advance, it helps for you to learn how to do hand expression. And a lot of you probably aren't quite to term, or maybe you are, but that's something we talk to you more about later in pregnancy. Between like 32 and 37 weeks, we start giving you guidance about that, because you usually don't start collecting colostrum until after 37 weeks. And you can freeze it, you can save it for your baby, or if you don't get any, that's also fine. That's not like a goal to collect gallons of milk before your baby comes. The goal is just to understand how your breast works and maybe collect a little just in case you want to give it to your baby after they're born. Recovery. So recovery, of course, starts immediately after the birth. So we're there to just kind of monitor you and your bleeding. And then we're also around, we see you like the first day that after your baby's born and prior to your discharge home. We also see you in the clinic, usually virtually, but sometimes in person around 2 weeks. And that's just a check-in to see how you're doing, both physically and emotionally, and also check in about breastfeeding. And then, of course, we're always available even between appointments. If something comes up, you can always contact our office anytime if there's something you're concerned about. On a side note, I also work as a mental health nurse practitioner. So sometimes I see people for their mental health outside of the midwifery clinic in our women's wellness clinic too.
Thank you so much, Laura. I appreciate you. Laura's is also unique because she's 50% women's wellness, 50% midwife, and we really appreciate her expertise in guiding us with mental health, because I think postpartum or the 4th trimester is something that we need to talk about more. It's difficult sometimes, and it's so important to have that support. Megan Dre How do midwives handle complications or high-risk pregnancies?
Hey guys, I'm Megan. I am gonna apologize now for probably all the background noise. I have 3 kids around doing all the things.
We're moms too, it's fine.
Yeah, so I was like, one's right here. As Amber said, I'm Megan. I am actually one of the midwives that works in the high risk division. So I am at the main campus. I am in clinics on Mondays and Thursdays. So if for some reason something in the pregnancy became high risk where you needed a maternal fetal medicine specialist, that is where you would find me. Otherwise, I'm also on call with the midwife group, delivering babies in the hospital. As far as my question, so how do midwives handle complications or high risk pregnancies? The beautiful thing about delivering at the more likely the main campus is that we can do quite a few high risk things. And part of that is because we are trained to do some of them. If for some reason that is not something that we're able to handle or equipped to manage, we have wonderful physician colleagues that we would transfer your care to. At the main campus, we also work very, very closely with our physician friends. They're in the same room as us when we do all of our work. So if we need help or assistance, they would be right there beside us. So something that we're very trained in handling. And if we're not, we would transfer you.
Thanks, Megan. Sorry about the delay. I lost my mouse between my 3 screens here. Next we have Meredith, Meredith Parizek. And Meredith, I feel like we maybe talked about your question that I originally gave you. So is it okay if I just give you one of the Q&A questions?
Yep.
So can I choose which hospital to birth at?
Yeah. My name's Meredith Prezek. As Amber said, I where we have clinic, correct? I have clinic at the Muscatine outpatient outreach clinic on Mondays. And then I am at North Dodge Clinic in Iowa City on Tuesday. So it's kind of fun to be able to be at the 2 different locations. As far as choosing where to deliver at, yes. Usually, as long as you are low risk, as many of our patients are, we give you the option to deliver at either location, either the downtown, the Old Mercy Hospital in Iowa City, or the main campus, which is the traditional hospital that many people are used to. We have a set of criteria. So as long as you are under a certain BMI and have never had a C-section before, different things like that that make your pregnancy a little bit more complicated, then you can absolutely deliver at the downtown campus. The good thing is we are doing our best to cover both locations as often as we can, so that you can get midwifery care at either location, whether you are considered more high risk or not. We are really trying to promote and motivate people to come to the downtown campus right now as well, just because, again, the majority of our patients are low risk. So that's something that can absolutely be discussed more at your OB visits too, if you have any questions about whether you are a good candidate or not.
Thanks, Meredith. And then next we have Rosemary Anduso. She couldn't be with us tonight, but she is a midwife that recently joined us. I don't think I mentioned Kelly Horn. She's another midwife that recently joined us that couldn't be with us tonight. And then Sarah Jones, I don't think could be with us tonight either, but Sarah Jones is the 3rd midwife that does the high risk OB clinic. Bree Herring, do you want to tell us a little bit about yourself and do your question? What can you do to prepare for postpartum?
My name is Bree. I'm one of the midwives that works in an outreach clinic, kind of primarily. So I do the Cedar Rapids clinic every Wednesday, which I really like. I also do clinic at IRL on Thursdays. I think that there are a handful of things that people can do to prepare for the postpartum period. I think during pregnancy, it's really easy to focus a lot on the birth and kind of forget that
the birth will just happen one way or another, no matter what. And ultimately, we probably have a little bit less control over it than we wish that we did. But the postpartum period is much longer, and something that I think that some preparation can really help make it a little bit more smooth. So one thing that I found during, the last decade or decade and a half of helping people have babies is that I think our culture really tells us to be independent and strong and not accept help from people. And that's almost the exact opposite of what you should do when you're postpartum. So my recommendations are like, read all the things that you can, try to prepare for infant care, take the classes. I know Laura mentioned colostrum harvesting, have some meals in the freezer, but really when your friends and family offer to help you, just say yes. Don't be proud. They want to help you. It makes them feel good. So I always tell people, like, you're doing them a favor if you accept help, because they feel really good about themselves. So if somebody's coming over to your house and you need something picked up from the store, just ask them to grab it. Or if they're at your house and they offer help, have them fold a basket of laundry. Like, these things make them feel good and they're so helpful to you. So just let your community be a community for you, if you have access to that. And if you don't have access to that, trying to get, some meals prepped and some healthy snacks in the house and a basket of things that you can munch on while you're stuck in a chair, either breastfeeding or feeding the baby with a bottle. I think a little bit of that preparation can make the 2 a.m. wakings a lot more easy.
Thank you, Bree. And then Christina Shutters, I'll have you introduce yourself, Christina. And then your question was, what do you want every first-time mom to know?
Hi, I'm Christina. I am one of the midwives, I think they talked about earlier, that does clinic in high risk and then labor and delivery with the midwives. And one thing that I think is important for moms to know, I would say it kind of goes with what Bree was saying in preparation for all stages. So not focusing solely on the prenatal care or on the birth, but truly thinking of sort of all the time that you're going to have to take care of your newborn too. So planning to have things ready at home when you get home, like having frozen meals and things like that lined up is really helpful, and sort of all of the supplies that you'll need for the first couple weeks so that you can go out when you want to go out, but you don't have to go out to get essentials that you already have. And did we talk about our birth plan already online?
Nope, that's coming up next.
Oh, okay. Well then, knowing about the birth plan, and I'll pass off the baton for somebody else to talk about that.
Well, that was a great entryway to Andrina to talk about the birth plan, or what we call as the pregnancy roadmap. And let me try to do my best to share my screen. Oops, Sophia, can you please enable that I can share my screen, please? Okay. The pregnancy roadmap can be found by just Googling UIHC midwife birth plan, and it's the first thing that comes up. It's also something that we give to you at your 32-week visit, kind of as homework to go through. Okay, perfect. Can you guys see that? Just give me a thumbs up, please. You can. Okay, thank you. All right, take it away, Andrina.
Okay, so this is our birth map. We call it the roadmap. It's more of a guideline, I would say, to some things that may or may not be in the facility and available that you may not know are there, or things that come up, whether it's with your newborn baby afterwards, or things to do even leading up to the ending part of your pregnancy. Some things in the very beginning are things that you can do throughout your whole pregnancy that we'll touch on when we first see you, especially for your new OB. We'll go over some of these guidelines, and then down below you can write people like your birth companion, whether it's a friend, a partner, a family member, whatever that may be. It's somebody that we can get to know, and so if we're going to see them, we can also recognize that they play a really important role in your experience as well. So anybody that you want to be a part of your story and your birth, you could put in that section right there. For the tool chest, kind of the things I touched on just in the beginning, we have several different types of like peanut balls of different sizes. Those can really help when you are resting, to help just really open up that pelvic space and to help that baby move down the birth canal. And then also we have like the balls that you can sit and kind of bounce on, whether it's just for pain relief, movement, things like that. Walking, we have there's tubs at both hospitals. And so those are really good for pain therapy, but really just to relax as well if you want to use the tub. So those are really important. A couple different pain medications in the IV that are offered prior to, if you choose to get an epidural. Those are things that we can go over with you. And then also music, I touched on that with bringing that to the hospital as well. You can bring music that is soothing to you. I also know that there's some really good like hypnotherapy tracks that you can bring that are really neat too. So monitoring during labor, it really depends. If you come in and you're laboring on your own with no intervention, we can do intermittent monitoring. And so that means we just kind of monitor your baby every so often just to make sure that your baby's still doing well in your labor experience. If you are on any medications, we do need to monitor continuously. So it's really just dependent on your situation. For care team for labor and delivery, we do have residents, we have medical students, we also have CNM students now. They're all there to learn. It is completely up to you. We do, sorry, somebody else kind of can help me out with this piece. Hold on, I gotta shut my door here. So we have several different types of learners that are there. And so you just tell us in this roadmap, or we can talk about it in clinic a little bit more about what that means individually, but you essentially will just check what you would like to be for a part of your experience. And then requests for births. These are things, a lot of what I see on these, like delayed cord clamping is one, which is actually routine care now, but it is one that I see often. Some moms like to kind of reach down after we essentially make sure the baby is strolled safely out. They like to reach down and kind of, whether it's the dad or the mom themselves, help deliver the baby, which is really neat. So some people will put that on there. Just anything that you can think of that's important to you that we can bring this paper back and we can discuss, you can put in this section right here. For whatever reason you ended up with a cesarean, there are some special requests that I have seen. For example, like as much as we possibly can have baby on the skin. I've seen that on there just up top, kind of by your head, and tuck baby in there. There's different requests. Like if you have anything that you've seen or heard about that you would like on there, we'll do our very best to make that happen. So you can just put that on there and we discuss that in clinic when you bring it back too. And then about the first few hours, yes, these are the things like with the baby after your baby's born. And so these are things that we talk about when you're in clinic as well. So if we talk about newborn medications that are available, we talk about whether your desire is to breastfeed, bottle feed, everybody's experience or everybody's desire is different. So we'll just go through what that means, what you would like, what's available. We do also have like donor milk available at the hospital, which is really neat. So we just go over those things in clinic. So when you come in and all of those things happen, then we already have an idea of what your desires are for your experience. And then afterwards for postpartum, so it's 2 days for a vaginal birth and up to 3 if you do end up having a C-section. There are moms that they want to go home at 24 hours, and there's some moms that really like to stay and they like to take their time and have all of the nurses there to help for another extra day, just to be able to get a little bit more rest or whatever that reason might be. So those are just things that we talk through, and then postpartum things that we talk through when you're there. And that's it. I think that's the end of it, right?
Yeah, that's the end of it. Thank you so much. All right. And then next, I think this is kind of a good segue for Bree to talk to us about the role of learners in labor and delivery.
Sorry, it always takes me longer to unmute than I think it will. Yeah, so we have several different types of learners that our patients may see or interact with upon labor and delivery. So the midwife students are kind of a fun new addition that we've had in the last couple of years. Our midwife students are nurses, so they're experienced labor and delivery nurses who are transitioning from being RNs to being midwives who provide kind of like the prenatal care and then help kind of run the show for the birth versus doing more like the hands-on care that the nurses do. They typically do a lot of like the 24-hour shifts with the midwives. They'll really be paired with the midwives. So these students are never doing care independently by themselves. So you would never have like a midwife student in the room making decisions with you without the midwife also being involved. So I think some people get nervous that the student is going to be making management decisions or performing procedures without the midwife, and that would not be the case. I always really encourage people, if they have the opportunity to have a midwife student, to do it. These people are so passionate and so excited about catching babies, and I have yet to have somebody come back and tell me that they didn't have a good experience with a midwifery student, and I've been precepting students for 12 years. So those people are awesome. I would highly encourage you to let them attend your birth if they're available. We also have medical students on the unit. These people are also very excited about learning about birth. They are not labor and delivery nurses, so they're in more of like the traditional learner role where they're sometimes seeing things for the first time or maybe the second time. They don't tend to do much hands-on. So our labor and delivery nurses have been doing things like checking cervixes for years and years. So this is not a new skill for them. The medical students don't do those types of skills, but they might help with things like admission questions, especially if your midwife is in another room helping another baby be born. So sometimes they can help with things like getting your triage process started just so that you don't have to wait a long time if the midwife is caught in another area. We do also have resident physicians. So residents are doctors. They've graduated from medical school and then they're completing their training in obstetrics. So we have residents that are kind of on the newer end in the first 1 or 2 years of their training. And then we also have residents that are in the last couple of years of their training. You may or may not interact with those people while you're there. The residents who are in their first 2 years of training do a lot of the normal births with the midwives. This is really, really great experience for them because it's wonderful for them to see how normal birth can be. A lot of our patients just have really lovely, nice, normal births. And I think it's really refreshing for them to see that, especially working in a high-risk facility like the one that we work in. And then the second, like the third and fourth year residents, most of the time you wouldn't interact with them. They tend to be more involved if there's something complicated going on where we actually need the OB team involved. So if we need the doctor team in there for some reason, if the baby's misbehaving, or if we think that a surgical birth might be safer for either the patient or the baby, then they would be part of the team that would come in and kind of talk to you about all your options and then possibly tag in on your care. So lots of different types of learners. It tends to be a really good experience. You get a lot of different levels of attention from everybody.
Thank you, Bree. Christina, could you tell us a little bit about what sets us apart? Like what makes midwifery care different?
So I think, can you hear me okay?
Yes.
Okay, so I think the main things that set us apart in midwifery care is truly the focus on physiologic birth and really trying to let your body do what it's made to do on its own, and being patient, trying to be, more of the higher touch, lower intervention. We know how to intervene and when to intervene. We just prefer to let the body do it naturally on its own if we can, without having to interrupt that. Because we know when it gets interrupted, sometimes it can lead to a cascade of interventions. And so if things can go naturally, that is our preferred route. So that is what we strive for. It's not always possible, but when it is, it really moves along much nicer.
Thank you so much, Christina. I really quick just wanted to take the time to respond to a comment in the chat. And I just really wanted to say to that person, thank you so much for taking the time to share your experience and feedback. And again, we want to sincerely apologize for the delay in the webinar and for the distress it caused, especially given the painful and traumatic experience that you shared. And what you went through sounds incredibly difficult, and I'm sorry that our communication misstep today contributed to a sense of being unheard, because that's certainly not the model of care that we're trying to show to you all. We deeply appreciate your grace and not placing the blame, but it's still clear that the impact was real and significant. And I just want you all to know that your voice matters and we take your concerns seriously, and that the feedback will be shared with our team to help that we're improving every day. And you all really do deserve to feel safe and respected and confident in your care, and we're really committed to doing better. So thank you for your feedback on that. Laura Delos, could you talk to us a little bit more about the options for birth, MCD and MCU, and what do these acronyms mean?
Sure. So many in this community will recognize what we call MCD as what was formerly Mercy, which is a community hospital that's done birth very well for many, many years. And the university took that unit over, took the whole hospital over about a year and a half ago. And we have been providing birth there this whole time. There are a couple of providers that were originally there that have stayed and participate in call for OB patients, and then a group of physicians from the MCU, the Medical Center University, are also sharing in call over there. We are endeavoring to have more and more of a midwifery presence. I had 5 deliveries there between Tuesday and this past Sunday that were just amazing, and all first-time moms, and they all, I think, felt a lot of support. The care both places is excellent. We have great nurses, both spots. We have anesthesia available to us in both locations. We have pediatric support. When I needed the pediatrician to come in for a delivery, I just called and he was there for the birth. So we have that available at the downtown campus. At the main campus, there might be reasons that we would want to have someone deliver there. For instance, someone that's having a labor after a cesarean birth, or someone that we know their baby needs potential early care with our NICU team. So there would be reasons we'd want you to deliver at the Medical Center University, but we would encourage people to look at both options and talk with us about what's available. And both places have tubs. That's the other important piece. We're working on getting telemetry monitors for all the rooms at the downtown campus. We've got birth balls there now. So a lot of really positive momentum to support physiologic birth in that setting, as well as what we're doing at the MCU.
Thank you so much, Laura. And then we're gonna move to some more of our pre-submitted questions. Jackie, what resources are available to aid in an unmedicated birth?
I think a lot of these things have been mentioned already. All of our nurses are trained in something called spinning babies, which is movements that can be done to help facilitate movement of your baby into your pelvis and optimize delivery. We have all kinds of birthing balls, different shapes and sizes. I sometimes joke that you could even pick your color if you wanted to. We have tubs in our labor rooms. There are times where the main hospital campus is busy and you might not be able to start out in a room with a tub, but if your goal is to achieve an unmedicated delivery, our goal is to get you into a tub room as soon as we can. There are squat bars. There are things called a cub or a birthing stool. As Andrina mentioned earlier, you can bring your own aromatherapy, but we do have some on the unit as well. The only thing that we have to make sure is that we do not infuse it into the air, as it can go into the hallway and bother other patients and their family members, and can cause reactions for people with allergies. So I think we have a lot of good things. There's, combs. You can have, there's lots of little things like, squeezing a comb. We have several of those available if you want to distract yourself from the pain. Um, if there's something in particular you're wanting, don't hesitate to ask in your appointment. We're always looking, like Amber said, to do better. I will say the one thing that patients have requested in the past that we do not have and have not been able to get is a TENS therapy unit. So if that's something you're interested in, probably would want to bring that yourself.
Thank you, Jackie. Kimberly, what is the process for deferring to a doctor when one is needed?
Well, on labor and delivery, we actually always have a team available, so it's pretty seamless. At the main campus, we always have, like it's been mentioned, we have different levels of residents, including a chief resident. We always have a generalist that's working with us. And so if we need to go to a cesarean section, for instance, our generalist, our chief resident are going to be working with us. And if it was sometimes we're anticipating things are coming up. And so we've usually already talked to them and let them know that we, may need to move toward, a cesarean or an assisted birth. We also always have a staff in the background for our MFMs or maternal fetal medicine physicians who are truly the specialists regarding all things. And as Laura discussed, our pediatricians are always available to us. So we have a full team available at all times in labor and delivery. Now in the office, we also, for instance, in Muscatine, I work with Dr. Ely all the time. So there are times during prenatal care where we may want a physician to see you for a visit, and maybe it's to go over a plan of care and to make sure that, is there anything additional they'd like to, add to the plan, or, just to review it as well, or answer questions for you. There are times when during a prenatal time, a risk factor will come up that requires someone to transfer their care to physician. And again, that's pretty seamless because we're all a team that works together. An example would be, say, a gestational diabetic that needs to be on insulin. That is someone who would transfer their cares to one of our physicians. We would set that up and move their appointments to one of the physicians that would then manage their insulin for them. I know for myself, and I'm sure everyone else would do the same thing. I always make sure also that we are still available to you. If you have questions, concerns, if you're here to visit and you want to have a small chat, I always try to remain available to you regardless.
Thank you, Kimberly. Lastasia, can the midwife and the gynecologist work together on the day of birth?
Yeah, kind of going along the same lines of what I said earlier and kind of piggybacking off what Kimberly said, like absolutely. In instances where we need to work together, I'd say probably the most common situation where we're working side by side is if our patient needs to have a vacuum or forceps delivery, so we're right there still, and the OBs are working to get baby out with vacuum or forceps. We also have patients who come in, like if their baby's not head down or something like that, and having an attempt to turn the baby down. It's called an external cephalic version. So that's another time where, we're available to say hello, and the doctors get you all checked in and do the attempt. And then, depending on what happens, you may still follow up with us, or, if it's later in the pregnancy, closer to your due date, we might go straight into an induction. So it's really like very much just getting you what you need in the moment. And, certainly in emergencies, if you're someone who ends up needing to have an emergency response or something, you'll realize how many people are actually around and ready to respond, because there'll be one person in your room, and then all of a sudden there'll be 20 people in your room to make sure you're getting the care that you need. So we try to keep it as quiet and peaceful and as low intervention and as minimal number of people as possible. But when we need all hands, they will appear.
I'm really struggling unmuting myself. I'm so sorry, you guys. Laura Delos, what are some common circumstances where care might be transferred to an obstetrical specialist?
So that can happen prenatally. There might be things like someone that has diabetes in pregnancy that we try dietary management, but even with the best of trying, that darn placenta is just in overdrive and someone may need insulin. So that is something that we wouldn't manage in the midwifery side of things. We don't take care of patients with twins. So if someone in this practice, so if someone came in with a twin pregnancy found early in the pregnancy, then we would have them see one of the physicians that we work with. In labor, placenta abnormalities, those sorts of things would also be reasons ahead of time. In labor, if someone developed severe preeclampsia either before or in labor, that would be reason we would have our physicians step in and take over, because that requires medications that, again, we as midwives don't typically use. We might ask for their help, not necessarily turning care completely over, but their help in just us determining maybe what position the baby's head's coming down, or repairing any sort of tearing that might happen with the delivery. Someone whose labor isn't progressing and recognition is made that a cesarean birth is needed, we would bring them in and they would take care of that. And depending on the location at the downtown campus, we would be probably there assisting them for that. So there's a number of reasons that can happen, but thankfully they don't happen very often. Most all of our patients are able to stay with us through their entire pregnancy and birth experience.
Thank you, Laura. Laura Hannah Bergen, your pre-submitted question, I feel like we've answered a lot. So I'm gonna switch it up and give you a different one, okay? Because your pre-submitted question was other pain management options other than an epidural. So I was wondering if you could tell us what supplies will be provided for babies and moms when the baby is delivered.
Good question. And we get that a lot because people want to know, should I bring like all the diapers? Should I bring the clothing? In reality, whatever you have on right now, if you come to the hospital and you're pushing your baby out, they have everything you need. Like they have a onesie, they have diapers, they have, all the things that your baby would need if you don't have it with you. However, there might be things that are specific to the way you want to, either breastfeed or parent or dress your child. And so those things that are specific to you, please bring along. But like if you need like a pacifier, or if you need a nipple shield, or if you need a pump, those things are available.
Thank you. Megan Dre, our water bursts at UI Healthcare, and maybe also you can tell us a little bit how we utilize hydrotherapy.
So the short answer is, as of right now, no, we do not do water bursts at UI Healthcare. There are certain requirements that the tubs have to have for us to be able to deliver in there, and we just don't have the capacity at this moment to be able to do that. As far as being in the tub before you deliver, you can kind of labor in the tub as long as you would like. I tell my patients if they're in there and they're kind of involuntarily pushing, or all of a sudden they feel a bunch of pressure like they need to poop or push, that's when we'll maybe very quickly help you out of the tub, just so that we have more space to kind of safely deliver your baby and to take care of you. There are lots of things we can put in the tub. Some people bring their own little candles. Some people bring little tea lights. We have essential oils, all of those things. We can turn the lights down really low. You can put peanut balls and cub stools and kind of all of those things in the tub as well. So it's a really nice space to be able to labor and then deliver somewhere other than the bathtub.
Thanks, Megan. Meredith, can you tell us, can you get an epidural if you work with the midwives?
Yes, you absolutely can. If that's what you desire with your labor and your birth, then by all means, we support you in getting an epidural. As I tell all of my patients, get it when you need it. Okay, so let's try to do those other things first, like get you up and out of bed, walking the hallway, sitting on your birth ball or your cub, using your partner or your labor support person to help with different positions, trying to do all those upright things while, especially while you're in early labor, so that you can help get your baby down into your pelvis. And then when you're feeling like you're tired or the pain is just too much for you, you need extra medication support, that's when we can discuss either IV pain meds with you or getting your epidural.
Thanks, Meredith. Midwives, we hit the end of our questions. I want to give the attendees an opportunity to put some last minute questions in the chat or in the Q&A. We're happy to answer whatever you have. I think that one of the popular things that we've done in this webinar is talk about the birth prep, like any books or podcasts or anything that we really enjoy. I don't know if any of the midwives want to shout out a couple of resources that you really like.
I do. I really like fact-based education. And 2025 is a much more challenging time to help people find good information than about 10 years ago. As social media has kind of become like the way that most people consume information, it's really changed what our patients are seeing and hearing. And I can tell you, I see a lot of things that are just made up. And I know they're made up because I have a couple degrees and have unfortunately read some like giant textbooks that like literally one of them is sitting next to me right now. But we don't expect our patients to have that background and to have that knowledge. That's what we're there for, not to make decisions for you, not to tell you what to do, but to help explain things to you and help you make decisions. So my biggest request for people is to try to not let the algorithms figure out that you're pregnant for as long as possible, because once the algorithms figure out that you're pregnant, you're going to be bombarded with a lot of influencers whose entire career is to get you to click on their videos so that they make money. And they do not have a duty to take care of you, and they do not have anybody fact checking them. So when you come to us for your initial couple of visits, at your new OB visit, we actually give you a printed list of like books and podcasts and websites that we recommend, because they are actually vetted and we know that they are using resources that are accurate and that are correct. So my very favorite website that I recommend to a lot of people, especially when they've read some, I would say kindly inaccurate and maybe more, depending on the day, unkindly, like just really made up stuff about things like the vitamin K shot, I would direct them to a website called Evidence-Based Birth. It's run by a nurse who has a PhD, and her entire website is just her going through like every piece of literature that's ever been published on the vitamin K injection for newborns. And then she doesn't tell you what to do. She doesn't give you her opinion. All she does is summarize the research in a way that people who don't have a doctoral degree can understand, so that you can make a really good decision for your family. Because it's hard when you're hearing over and over all day long to realize like what you're hearing might not be the best source of information. And, you know, we only get 15 to 30 minutes with you at your visits. We would love to have more. That'd be awesome. But, you know, a lot of people have babies, and so we have pretty full schedules. So if you're able to kind of have good resources that have accurate information from textbooks and from published studies, rather than people who are content creators, I think it just makes it a lot easier for us to talk those things through with you when you're there and to kind of answer your questions. But again, I'll just make a big plug for Evidence-Based Birth because I think she does a fantastic job and it really helps answer people's questions. It's a good like starting point. We're always happy to explain these things as well. You can tell I'm middle-aged because I'm ranting about social media. Sorry.
No, Evidence-Based Birth is one of my favorites too. They have a podcast and a website, and sorry about the small person. I also really love mindful birthing. And if there's partners that really like want to know how they can support you in your birth too, the birth partner is another really good one, I think. Any other midwives? Sorry, she's mom wife. All right. There was a really um great question in the chat. Are birth photographers allowed at UAHC? If so, and the birth turns into a section, can the photographer go into the OR? Can any of the midwives answer that for me?
I know that you can have a photographer in the labor and delivery room, just no video until like after the baby's born, and then it comes out and like is up on your chest. I believe you can start videoing at that point. But I don't actually know if they can go into the OR.
I'm pretty certain that any person beyond your partner in the OR has to be approved by the anesthesiologist who's on at that time.
But we do also take photos for you in the OR because we kind of turn into a support person. And like one of the things that we like to really do is capture like the initial moments of like when you see your baby, when we kind of try to have baby up on your face, get a picture of you, your significant other partner or support person and your baby. And so we try to do a really good job capturing those moments if for whatever reason they can't go in.
Just me trying to unmute again. Yeah, that's a good point. Like when you go back to the OR, if our patients go back to the OR, which by the way, we track our C-section rates every month. And we track something called an NTSV C-section rate, which stands for nulliparous, which is your first time mom. Term, meaning you're over 37 weeks, singleton, meaning there's only one baby, and vertex, meaning the baby's head down. That rate in the last few months has been 7 to 8% for us. So like really, really a low rate. And to kind of give you an idea, the national average is about 30%. So when if you do have to go back to the OR, we do go back with you, like Andrina said, to try to facilitate that skin to skin. And then actually at the downtown campus, the midwives are able to first assist even in the C-section. So we can still be there to help facilitate those things.
Just to add to that, Amber, our rate for all of 2024 was about 15%.
Pretty good.
Mm-hmm.
All right, midwives, anything else to add?
There's a couple more things in the chat.
Oh, one more question. How many people can be in the delivery room? I believe that is 4 right now, right, guys? 4, but I don't think there's a limit on who can be there postpartum. That does change during like RSV and influenza season sometimes.
But we're through that right now.
We're through that right now, yeah.
Looks like someone has a question about how many, or about seeing the midwives. And I think the reality is that it would be very difficult to meet all of us. In fact, it would be impossible to meet all of us in your pregnancy, which is why we are doing Meet the Midwives, so that these people can sort of see our faces and hear our voices, and we have our profiles online. And I think it's important for you all to know that we meet every week as a practice, and we talk about concerns, we talk about things going on in patients' situations and lives, and we talk about any special requests that might be something new that we haven't heard before, that someone wants to do, and really try to, work together as a team on all of this. And it's just, we all are midwives. We're all on the same page for honoring that midwifery approach to care. And I would encourage people to see maybe 1, 2, 3 of us during your pregnancy, and get to know us. We get to know you. And then the honor of this is that because we are a group practice and there are a lot of us, when we come on, we're pretty excited to get to come in and deliver your baby. And I've done this a long time, and I've just found over and over again that generally the person you need, we all practice very similarly, but maybe just that personality that you needed. It's amazing to me how many times that individual personality was just the right person for you at that birth, at your birth.
Mhm. The birth gods, I think.
Goddesses.
Yes, excuse me. Gosh. And then another question about having nitrous oxide available during labor for pain relief. We talked about, she said, I know IV meds are available and an epidural. I'm working on it. I think it'll come soon, but can't officially announce that yet at downtown campus. Do all the midwives have, oh, maybe you guys just answered that.
Sorry, I typed an answer.
Oh, you're so fast.
It was a very long answer if you want to expand on it.
No, that's the question was, do all the midwives have equal percentage delivery responsibility, or do some of you attend births more than others? But yeah, Bree's response is perfect, because some of us are what we call core faculty in the nurse midwifery education program. Some of us have grants, and so with the grants, like we call it bought time, where we're able to like focus some of our time on that or focus some of our time on research. And so then clinically you're not as active, if that makes sense. Really great questions to you guys. Is there anything else the midwives want to add? Okay. Thank you for taking us as we are. We appreciate you all. We promise to hold space for you. Shared decision making, informed consent, trauma informed care is crucial in our practice. Thank you for taking me with my crazy 3-year-old on my lap as well. And we'll send a follow-up after the webinar. And it'll have my email on it too if you guys have any questions. We look forward to seeing you all in clinic. Have a great night.
Once again, I want to say thank you all for joining us. I want to say thank you to our nurse midwife team for being here and providing such valuable information. And once again, sincerely apologize for the communication on time. When you are exiting from the webinar, you'll be prompted to complete a short survey of our program, and we ask that you take a few minutes to provide us with your feedback so that we can continue to make improvements and provide our viewers with the best experience possible. This concludes our Meet the Midwives webinar, and thank you so much for joining us.